I'm Jessie. I am an integrative doctor of physical therapy in Colorado, and I'm going to use my tune-up fitness balls to facilitate some mobilization of the bottoms of the feet. Enjoy. Now, I like to make a differentiation between what a lot of people think of when I say rolling the bottom of the feet, which is kind of like this just general rolling, kind of a little too fast in my opinion, of the fascia at the bottom of the feet. That's, I don't think, is effective as what we would call pinning and then mobilizing. So let's take the affected foot forward and let's go as far back toward the heel where you still can have the heel on the floor. Now I have a lot of ankle mobility here. You might not look quite like this, but you're basically, the goal is to roll the ball back as far as you can where your heel is still on the floor. From here, you can flex the foot like you're trying to grab around the ball with your toes, and then spread the toes and lift and expand. And curl down and around and spread and lift and expand. Then roll incrementally back one segment, we'll call it, and same thing, heel is planted on the floor and you're rolling the toes forward and down and lifting the toes up and away, and repeating that 5 to 8, maybe even 10 times. And then we'll go segmentally forward once more or twice more, just depends on the size of ball you're using and the size of your foot. Now, I went straight down the middle of the foot, but you can repeat this down the lateral aspect of the foot, which is on the side, curling and expanding and moving back, curling and expanding. I'm doing this a little faster than I normally would. Or you can go down the medial aspect. And really, you're looking for the area of the foot that has a little bit of tenderness, a little bit of sensitivity. You can work that area a little bit extra, stay a little bit longer, and then move segmentally up. You can also, instead of being so linear, like what I'm showing so far, you can just find in the foot what area feels the most sensitive and just work there. So this all so far has been demonstrated with the heel down. And then the other version is rolling forward, letting the toes be grounded, and then you're just pressing weight into the ball and then going side to side and then coming off of it, pressing weight into the ball, moving the ankle laterally and medially. I'll show this from the front. Toes are planted, I'm putting weight into the ball, and then I'm rolling to one side, then the other with the weight still in the ball. And then from there, we can roll back a segment, and same thing, press down. Even just pressing and holding is a nice release. Fascia likes to have a little bit of slowness, a little bit of finesse, a little bit of hanging out in an area of tension, and then eventually lets go. If you just roll really quickly, it might feel good and that's fine, but you're not going to get as effective of a fascial stretch than if you pin and hold and allow the fascia to melt underneath your tissues, underneath the ball. And so those are my favorite ways to roll the feet. And as I said, different size ball might have a different effect. If it's a smaller ball, it's going to be more pinpointy for you. So you might explore different sizes. I love the tune-up fitness balls, but you can use a racket ball, you can use a tennis ball, and so on. And so have fun with your rolling. And if you do something like this daily, on a daily basis, you will definitely notice some changes in your mobility of your feet, your coordination, your comfort to be barefoot, your agility can even improve. And there was a study done where doing plantar foot work on patients with Parkinson's improves Parkinson's symptoms. So there's a lot, there's a reason reflexology is a whole profession. So really working the feet is going to benefit you in probably more ways than you even realize. So happy rolling.